Now, one of the first things we do when we get out of the shower, typically, is to put on an antiperspirant or a deodorant. But haven't you heard that using deodorant causes cancer? And haven't you heard that if you're a cancer survivor, you shouldn't use antiperspirants because they have aluminum in them? I'm cancer physical therapy specialist, Dr. Leslie Waltke, and in this episode of The Recovery Room, we are going to do 3 things. First, explain the difference between deodorants and antiperspirants. Second, we are going to debunk the myth that deodorants cause cancer. And third, we are going to explain the confusion around antiperspirants, aluminum, and cancer. Let's begin with topic number 1, clearing up the difference between deodorants and antiperspirants. Now, deodorants don't stop you from sweating, but they do keep you from smelling. What actually smells in body odor is the byproducts of the naturally occurring tiny bacteria on our skin that eat the stuff in our sweat. Gross, I know. Deodorants eliminate those bacteria, so even though we sweat, we won't smell. Antiperspirants, on the other hand, actually keep you from sweating and therefore not smelling. Antiperspirants use aluminum salts to create a thin cover on the skin that blocks sweating. So if there's no sweat, there's nothing for the naturally occurring bacteria to eat, and therefore no smell. Topic number 2. Deodorants and antiperspirants do not cause cancer. There has never been any evidence that deodorants or antiperspirants cause cancer. Anyone that tells you otherwise is either uninformed or is trying to sell you something. Topic number 3. Now, for many years, if you needed radiation therapy to your breast, chest, or underarm, you were most likely asked not to wear an antiperspirant during the radiation. This is because it was thought that the aluminum in the antiperspirant could either increase the amount of skin redness reaction in the underarm or cause some of the radiation particles to scatter. However, studies done have shown that antiperspirants don't actually do that. So those recommendations are beginning to fade away. So in summary, if you are currently in radiation, there is no evidence that wearing a deodorant or antiperspirant is unsafe. And most importantly, there is no evidence of deodorants or antiperspirants causing cancer or impacting cancer recurrence risk. So from a cancer perspective, there is no reason to avoid using them and no reason to spend extra money on fancy all-natural ones or non-metallic ones. I'm cancer physical therapy specialist, Dr. Leslie Waltke, signing out from the Recovery Room. I wish you a lot of exercise-induced, smell-free sweating. We'll talk again soon.